Hi, my name's Dr. Catherine Hughes from Crime Psych. This video is part 2 of an analysis on Beverley Allitt, who murdered 4 children, attempted to murder 3 children and causing grievous bodily harm to a further 6 children. Yesterday, I released part 1 of this analysis, and that video talks about how she committed the murders and her assaults. In this video, I'm going to talk about her background, the psychology of her behaviour, and her mental health conditions. Beverly Allen was born on the 4th of October 1968, and she grew up in a small village near the town of Grantham. She had 2 sisters and a brother. Her father, Richard, worked in an off-licence and her mother worked as a school cleaner. As a teenager, she would often volunteer for babysitting jobs, and she left school at the age of 16, and then she took a course in nursing at Grantham College. As a child, Beverly would use factitious injuries in order to gain attention. She took to wearing bandages and casts over wounds and injuries, but would never allow these to be examined. As a teenager, she was overweight and she began spending an excessive amount of time in hospitals with various physical complaints. At one point, she even managed to convince a surgeon to remove a perfectly healthy appendix. That was extremely slow to heal because she kept on interfering with the wound. When they realised what she was doing, she would hop from one doctor to another, and she'd often behave aggressively towards others. I'd love to know exactly when these types of behaviours started and what was going on in her life, either immediately prior to this or around that time. If anyone out there does know, please let me know, because I wasn't able to find any information on that myself. Behaviours such as these usually begin because of some traumatic event during childhood or adolescence. There has been one interesting proposal for this behaviour to develop in the absence of a traumatic event, and I'll discuss that in the next section. She attended Grantham College in Lincolnshire and trained as a nurse. Her bizarre behaviour continued throughout her nurse training. While she was working at a nursing home, she was suspected of smearing faeces on the walls, and they discovered faeces being stored in the employees' fridges. Of course, it was only suspected to be her at the time. Her attendance during her nursing training was quite poor because of her many illnesses, and as a result, she failed her first nursing examinations. Her boyfriend at that time said that she was aggressive, manipulative and deceptive. He said that she falsely claimed to be pregnant, as well as claiming that she'd been raped. After applying for a nursing position at the hospital, Allitt was refused the position on the basis of concerns around her suitability for the role. She was undeterred though, and she then applied to paediatrics. Despite having trained in adult medicine, she was able to secure a position. Allitt managed to convince those in charge that she'd always wanted to work with children and that she'd developed the relevant skills while she was working in the role. She was able to obtain a position in Lincolnshire in 1991 as a state-enrolled nurse. Beverly Allitt was assigned to Children's Ward 4. It was only after several unexplained deaths and incidences that the staff became suspicious and Allitt was suspended. Although she was suspended with suspicion surrounding her possible involvement in tampering with patients' medication, she wasn't exempt from gaining alternative employment, and she was recruited as a nurse at a nursing home. It was here that Beverly Allitt's behaviour is thought to have spiralled further out of control. She became seemingly more deviant, and her behaviour was less directed towards children and then directed at the elderly patients. Confirmed accounts say that she would hide knives under residents' pillows and knock walking sticks out of their hands. She made the bizarre claim that it was the work of a poltergeist. Around this time, she's also known to have given a child a drink that led to him collapsing, and was even seen injecting an elderly resident in the care home with a large amount of insulin which she wasn't prescribed. It's been widely cited that Beverly Allitt did have a rare combination of Munchausen syndrome and Munchausen by proxy syndrome. These are fairly controversial claims for a number of reasons. With Munchausen syndrome, physical or psychological symptoms are either self-induced or feigned on oneself to gain attention, whereas Munchausen by proxy involves inflicting injury on other people to gain attention for themselves. It's very unusual for an individual to present with both conditions. Now, I said that it was controversial, and that's mainly because the Diagnostic and Statistical Manual of Mental Health Disorders fails to list both of these conditions as being clinically diagnosable or being psychiatric disorders. This is why that she simply pleaded not guilty rather than claiming diminished responsibility. In fact, two leading experts, forensic psychologist Jeremy Coyd and criminologist Elizabeth Yardley, examined Allitt's mental state when she was arrested, and they concluded that she wasn't mentally ill and should be in prison, not a hospital. Professor Roy Meadows reported that she was exhibiting Munchausen by proxy characteristics alongside inexplicably engaging in self-harming behaviours since their conviction. She was deemed to be putting her life and that of the other inmates at risk. Accordingly then, the Home Secretary gave a direction under the Mental Health Act for her to be moved from HMP Holloway to Rampton Secure Hospital. As an inmate at Rampton, she began her attention-seeking behaviour again. She was ingesting ground-up glass and pouring boiling water on her hand. Now, it would be easy of me at this stage to say that the experts have said that she had these syndromes and that's simply why she did it. A problematic behaviour, though, began early on, and it isn't clear at what stage or at what age they started. Most accounts state that whilst growing up, Allitt would frequently be seen wearing plasters, bandages and even casts. However, she wouldn't ever allow anyone to see these wounds and injuries because they didn't exist. She was overweight and she was known to self-harm. And these kinds of attention-seeking behaviours are usually the result of some kind of abuse or some kind of traumatic incident. However, as I have already said, I couldn't find any information online to suggest anything of that sort. A paper by Saskin, Wilmot and colleagues was published in a peer-reviewed article in 2017, which put forward a proposal for Allitt's condition to have developed in the absence of any trauma. And that is what I meant when I mentioned earlier about an interesting proposal for the formation of these behaviours and disorders in the absence of a traumatic event. They suggest that it's typical during a child's early development years that they frequently sustain injuries and illnesses. As a result of this, Allitt may have learned the behaviour through observational learning. Allitt is highly likely to have experienced such events and acquired attention and sympathy for them. She learned that when these incidents actually occurred, she received the attention and would have learned how to fake and mimic incidents and illnesses and still receive that attention and sympathy. The authors of that paper also suggest that the behaviour could be learned through operant conditioning. And this is where there's a reinforcement of attention that's given for displaying certain behaviours. Allitt may have observed and understood the consequences of illness and injury as being positive because of the attention that she was likely to have received as being a motivating factor for her. Ordinarily, there would be a negative association between illness and injury because of the pain and the discomfort. Many of her injuries were fabricated, which resulted in minimal pain, minimal discomfort, and a positive association to be formed between the two. Even when there was negative consequences for her behaviour, such as the pain and discomfort of her having an appendix removed, the positive attention that she received outweighed the negative pain and discomfort. Whilst that is one possibility for explaining why she developed these extreme attention-seeking behaviours, it falls a little bit short in my opinion. If such positive rewards and reinforcements can be so easily learned and then taken to extreme lengths, why don't we see more cases such as that? We learn through observational learning and reinforcements every single day, but the majority of people don't take their behaviour to the extremes that Beverly Allitt did. In my opinion, there must be some other factors influencing her extreme behaviour. Munchausen syndrome is a psychological disorder where someone pretends to be ill or deliberately produces symptoms or illnesses on themselves. Their main motivation is to assume the sick role so that people will care for them, and that person then becomes the centre of attention. There is undisputable evidence of that with Beverly Allitt throughout her life. Some people with Munchausen syndrome spend many, many years travelling from hospital to hospital, faking and mimicking a wide range of illnesses and injury. When it's discovered that they're lying, they might suddenly leave hospital and move to another area. People with Munchausen syndrome can be very manipulative and, in the most serious cases, can undergo painful and sometimes life-threatening surgery, even though they know it's unnecessary. Several factors have been identified as possible causes for Munchausen syndrome, and these include emotional trauma or illnesses during childhood, which often resulted in extensive medical attention, a personality disorder or a mental health condition that causes patterns of abnormal thinking and behaviour, or a grudge against authority figures or healthcare professionals. Munchausen's by proxy syndrome is where a person fakes or induces illnesses in a person who's under their care. Most cases involve a mother and her child, although there is some evidence of Munchausen by proxy also occurring within intimate partner relationships and in healthcare workers, but these are extremely rare. These conditions are more commonly referred to as fractious disorder and fractious disorder imposed on another. One of the diagnostic criteria of fractious disorder imposed on another is that the behaviour isn't better explained by another mental disorder, such as a delusional disorder or another psychotic disorder. And this warrants further exploration here because Allitt also appears to exhibit a number of characteristics associated with borderline personality disorder. She displays traits of interpersonal manipulation, self-centeredness, and an apparent lack of empathy. Borderline personality disorder is characterised as a pervasive pattern of instability of interpersonal relationships, self-image, affect, and marked impulsivity, beginning in early childhood and present across a variety of contexts. The first signs of Allitt's attention-seeking behaviour occurred in secondary school when she would frequently wear bandages, plasters and plaster casts without any medical necessity for them. These incidents were just dismissed at the time as being trivial and thought to have resulted in her clumsiness. Yet at one point, she managed to convince doctors that she had appendicitis, which led them to perform unnecessary surgery on her. However, even if those patterns of behaviour had been identified earlier, psychiatrists would be extremely unlikely to diagnose her before the age of 18. At the extreme end of borderline personality disorder is psychopathy. Psychopaths are defined as individuals who have no concern for the feelings of others, they have a complete disregard for any sense of social obligation, and they have an inability to form lasting emotional ties. When psychopaths turn to criminality, they use their charm and manipulation to coerce their victims into doing what they want. They might even use that charm to gain the trust of the person or of the victim. Psychopathy is typically assessed using Hare's Psychopathy Checklist revised. And that checklist is made up of two factors or sections. The first factor or section measures interpersonal and affective deficits. That means that it measures our lack of fulfilment and our feelings of emptiness or dissatisfaction. The second factor or section measures lifestyle and antisocial deficits such as marked impulsivity, juvenile delinquency and so on. Whilst Allitt may score on the Psychopathy Checklist, in my opinion, I don't think her score would be high enough on that to be labelled a psychopath. Allitt clearly possesses a number of characteristics that indicate a complex diagnosis, which most likely involves several disorders. The combination of Munchausen by proxy, and personality disorder created the extremely rare and disturbing patterns of behaviour that Beverly Allitt displayed. Now, Saskin, Wallet and colleagues in their paper conclude by stating that social learning theory, first proposed by Bandura in 1977, suggests that an individual's behaviour is often acquired and learned through a process of observation, imitation and modelling. The assumptions of social learning theory can offer an alternative explanation for Beverly Allitt's behaviour. As previously stated, growing up, Allitt would frequently be seen wearing plasters, bandages and casts. Explaining the transition, though, from self-harm to the desire to harm others, though, isn't as easily explainable using social learning theory and operant conditioning principles. Due to the length of time working in the healthcare profession, it's likely that Beverly Allitt had at some point witnessed the attention that the staff or the family members received when someone in their care was seriously ill and had died. Therefore, it's plausible that she'd replicated this behaviour to receive the same degree of attention. At first, Beverly Allitt's actions may not have caused death, but instead made children ill, and she would subsequently make them better. And as a result of that process, it provided her with the attention and the praise that she desired. Through positive reinforcement, the behaviour appears to have continued, and at some point, whether that was intentional or unintentional, her actions ultimately caused death. However, instead of acting as a negative reinforcement, the attention and sympathy that she appears to have got led to further positive reinforcement and the continuation of her behaviour. Now, this suggestion is a little bit speculative. However, this combination of factors offers a more complete explanation of Allitt's crimes, more so than Munchausen by proxy appears to do in isolation. I have included a link to that paper in the video description box so you can have a read of it if you want to. These crimes have had horrific and far-reaching ramifications. The mother of the twin girls was so grateful to Beverly Allitt for saving Katie's life that she asked her to be a godmother. Allitt accepted that role despite knowing that she inflicted partial paralysis, cerebral palsy, sight and hearing loss in the child. One nurse in charge was quoted to have said, "Poor Beverly Allitt had been there on every occasion. She's been a rock," and she was referring to the number of paediatric deaths on the ward that she'd been witness to. Sadly, that nurse later committed suicide, and it is widely thought to be as a direct result of being duped by Beverly Allitt. In conclusion then, Beverly Allitt murdered 4 children, attempted to murder 3, and caused grievous bodily harm to 6. She had a history of inventing illnesses and injuries. She was overweight and she'd self-harmed as a teen. She was assessed as being unsuitable for a nursing role, but was still allowed to gain alternative employment working with children, despite training in adult medicine. She was suffering from Munchausen and Munchausen by proxy syndromes, and she's attempted self-harm within prison by ingesting ground-up glass and pouring hot water over herself. She's inflicted fatal injuries on vulnerable young children who were under her care. That earned her the title of the Angel of Death. It's possible that she learned to behave in this way and received the attention like some kind of an addictive drug that she had to find and get at any cost. But when her preferred type of victim was removed, she sought the same rewards from different patients, so with the elderly adults that she was taking care of. It's possible that she harmed many more elderly patients because the detection rate of any wrongdoing can be reduced due to other explanations for death or injury in the elderly. Allitt's behaviour can be characterised as typical of those with borderline personality disorder. It's likely to be a very complicated set of factors that led to her offending. This is one of those very difficult cases where I can offer an informed opinion, but no clear report of the exact psychological factors that led to her becoming a dangerous killer. Since being held in Rampton Secure Hospital, it's been alleged that she wanted to marry in a traditional white bridal gown and have a wedding cake. The couple applied to the hospital's chief for permission to get married, according to some reports. A former slaughterhouse worker was sent to Rampton in 1992 after attacking a 63-year-old woman and then drinking her blood. The pair see each other 3 times a week at hospital dances and claim to have been engaged for 12 months. A spokeswoman for Rampton said, "I can't comment on individual patients' relationships, but they obviously do develop in the hospital. They're monitored by doctors and other staff, and if the patients are found to be of sound mind, they can marry if they want to do so. Relationships do develop," she said. "In fact, they're good for patients because it's part of their normalisation," she added. I do hope that you've enjoyed this psychological analysis of Beverly Allitt. More importantly, I hope that you learned something new. Thanks for watching. Bye for now.